welcome to our podcast. This is Closing the Gap, and we're your hosts, Camille Michel
and Cierra Treigle. Today, we will be discussing the disparities between oral and systemic health in America. As dental hygiene students, we see firsthand the common misconceptions that affect the public's knowledge of the connection between oral and systemic health. We wish to shed light on the discrepancies in hopes to educate both the public as well as other healthcare professionals about this important topic.
All right, Cierra, let's get this conversation started. I want to open our discussion by talking about generalized misconceptions regarding oral and systemic health. As future healthcare professionals in the field of dental hygiene, we learn how to properly educate others on the connection between the mouth and the rest of the body. However, this is often a widely unfamiliar subject amongst most people. Sean F. Kane, medical doctor and professor of family medicine at UNC, stated, "The oral cavity is the intersection of medicine and dentistry, and the window into the general health of a patient." This really stuck out to me because I couldn't agree more with this statement.
Camille, I totally agree. I often think other healthcare professionals and the community see the oral cavity and the body as two separate entities. I read a book the other day titled Teeth by Mary Otto. Great read, by the way. Y'all should go check it out. Long story short, the book tells a story of a man named Kyle Willis who had no dental insurance. He went to the emergency room complaining of a toothache and was sent on his way with a prescription for antibiotics and painkillers. However, he did not take the antibiotics. His dental complications escalated into a subarachnoid hemorrhage, ultimately leading to his death. His situation could have been prevented if everyone included was educated on oral systemic health.
You know, I find stories like this so upsetting and unfortunate because with greater education on what is such an important topic, events like this could easily be prevented. Side note, I read that book too, and it was so educational. I think dental school professors everywhere should assign this read to their students. There are many ways oral health can affect systemic health. One example includes oral microorganisms being introduced into the bloodstream. According to the Washington State Department of Health, the best way to prevent bacteria in the bloodstream is by minimizing gingival inflammation and accumulation of periodontal bacteria through good oral hygiene. Knowing this information is important because many dental procedures can predispose certain patients to complications, including endocarditis. Many patients may need to be pre-medicated before a regular dental hygiene visit due to their susceptibility to bacteremia-induced infections.
Camille, that is such a great point. Many people may not be aware that they need to be pre-medicated before a dental hygiene visit. There are so many ways the oral cavity can affect the body, but it can also be reversed. There are many ways a patient's general health can affect the oral cavity as well. One specific systemic disease that commonly affects the oral cavity is diabetes. According to Yvonne Capilla, DDS, there is a bidirectional relationship between periodontal disease and diabetes. Patients who do not manage their diabetes well will ultimately have a greater chance of developing periodontal disease.
I totally agree. It is so important for susceptible patients to manage their condition effectively in order to reduce their chances of developing these oral diseases. Another rising issue often seen within the dental healthcare field is the polydrug problem within America. This correlates with patients enduring systemic conditions and diseases because they must take medications to manage their health. According to Dr. Kane, there are more than 100 systemic diseases with upwards of 500 different medications that have the potential to cause oral health issues. Many medications used to control allergies, cholesterol, hypertension, diabetes, and many other diseases may cause moderate to severe oral manifestations, some of which include xerostomia, gingival hyperplasia, stomatitis, ulcers, and altered taste. According to the Washington State Department of Health, the elderly population is at higher risk due to the correlation between having more conditions and therefore requiring more medications. This has become an extremely relevant issue within America. As people are living longer, the need for more medications among the elderly is on a constant rise.
With such evidence demonstrating the connection between oral and systemic health, it is up to us as future healthcare professionals and other healthcare professionals within America to educate others on this topic.
Yes, Cierra, I think with a better understanding of how the mouth affects the body and vice versa, there is a chance we will see a decrease in oral manifestations, such as advanced periodontal disease. Now, to bring our podcast episode to a close...
Wait, Camille, you know what we almost forgot?
What? I could have sworn we didn't leave anything out.
The joke of the day. I think we have time for one.
Oh yeah, okay, let's hear it.
So, what award did the dentist win?
I can tell this is going to be a good one. No, Cierra, what?
A little plaque.
All right, everyone. That concludes our very first podcast episode of Closing the Gap. Thank y'all so much for listening.
We hope to see y'all next time, where we will discuss how tobacco and alcohol can double your risk of developing periodontal disease.